part of the purpose was to test the question of whether encorafenib might actually be a better BRAF inhibitor than vemurafenib. Laboratory-based evidence suggested that it might be. So when that drug was being developed preclinically, in head-to-head comparison studies in animal models, it looked like it might actually be a better BRAF inhibitor. And so within this trial was a direct comparison, a secondary endpoint of the study, but nonetheless comparing encorafenib to vemurafenib. It's actually the only time that's been attempted to even try to beat out one of the quote-unquote first-generation BRAF inhibitors, vemurafenib and braftovi, which were FDA-approved years before as monotherapy, and then later in combination with MEK inhibitors. So again, the preclinical concept was that encorafenib was engineered to be a better BRAF inhibitor. In this phase 3 trial, that was directly tested, and that was shown. In fact, the only time it's ever been attempted, and in fact was accomplished. So there was a statistically significant improvement in outcome in both progression-free survival, the primary endpoint of the study, and overall survival. So that was gratifying, but that wasn't the primary purpose of the trial. The primary purpose of the trial was to vet the new BRAF-MEK combination. The listeners to this discussion will remember that dabrafenib trametinib was the first BRAF-MEK combination to be approved in 2014, and about a year and a half later, vemurafenib and cobimetinib were FDA approved as well. So those were emerging at the time that this trial was designed and executed. So the goal really was to try to understand, basically, was this another example of a BRAF-MEK combination that would prove superior to a BRAF inhibitor? We thought the odds were pretty good that would be the case, since we'd already seen it twice. And then with this pooled analysis that we're presenting this year, the updated analysis this year, really the goal is to try to understand, do these results hold up over time for this new BRAF-MEK combination? So yes, it was superior at the level of both progression-free and overall survival, compared to BRAF inhibitor monotherapy, but that in some ways wasn't really news for this concept in melanoma. But now with the updated analysis, does that hold up?